Today's topic today. This is Ed Weir, and so we're going to talk about our today's topic, which is a bunch of surprising things a lot of people don't know that are covered by Medicare. And then, as you can see, we're going to open it up for live questions and answers. I did a couple of Q&As this week, kind of impromptu Q&As, and yeah, I wasn't able to answer all the questions, a lot of questions out there. And as you can see, we're doing another video next week on how to improve customer service, because if Social Security customer service gets to where it should be, then I don't have to do all these videos, and I can go back into retirement and go back into my cave. All right, so we've got Instagram. I added Instagram on here. I've got LinkedIn. I guess we hopefully have some people on LinkedIn. I'm trying to add as many platforms as possible to get the information out there, because, you know, millions of people aren't getting the benefits they're entitled to. And those that are about to retire or file for disability or survivor benefits or whatever the case may be, are stressed and overwhelmed and worried if they're making the right decision at the right time. So there's not a lot of information out there. So that's why I came out of retirement and started doing all these crazy videos. And here we are today. So make sure you type your questions in chat. I've got TikTok going there as well, but unfortunately, TikTok won't be able to see all of my screen images, because I need 10,000 subscribers on TikTok to do all that. So if you're a TikToker, please go to my TikTok page. It's MyGovExpert. All my pages are MyGovExpert, and then go in there and subscribe or follow or join or whatever you have to do for TikTok. All right, so let's go ahead and get started. Again, make sure you type your questions in chat about all things Social Security, retirement, disability, Medicare, Medicaid, and I will answer as many as humanly possible I can today. For you LinkedIn people out there, I think some HR people are joining. You know, have your employees, you know, you can provide this as a free HR benefit. Tell them to join and get all their Social Security questions answered. All right, so today our special topic is, oh, I jumped to number 2 instead of number 1. Our special topic is 11 things covered by Medicare that a lot of people are surprised that are actually covered by Medicare. And as with everything, the list always gets longer, and so I'm going to throw some extra stuff out there, some extra bonus material, I guess, right? All right. One of the things that a lot of people don't recognize about you know, Medicare is, well, obviously the Part D. Everybody knows about Part A, that covers hospitals, Part B that covers the doctors, but there's also Part D. Those are administered by private companies, but they're controlled and regulated, well, more regulated by the federal government. And the federal government last year made a bunch of changes in terms of the Inflation Reduction Act, and makes Part D better. This year, what they call it, the true out-of-pocket expense, the out of your pocket or other agencies that help you out. The max was $8,000, but next year it's going to be $2,000. So that is a beautiful thing. And remember, please, 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 I know someone out there right now is having a hard time, even, you know, with the $8,000, and still going to have a hard time next year with the $2,000 for you know, max out of pocket. There is the LIS, it's called the low income subsidy, the extra help with prescription drugs. It is the easiest Social Security application ever to complete. It's a you know, low income, low resource type program. So you have to have low income, low resources to qualify for it. But if you qualify for it, they estimate it saves up to $5,600, you know, average nationwide. So please apply for that. You can go to SSA.gov, and it's super easy. I've taken hundreds of thousands of those applications, and it doesn't take that long at all. Whether you're approved, that's a whole different situation. But in terms of the application, it's pretty easy. So savings on prescription drugs. Number two is better mental health. This is always a beautiful thing. Mental health, there was always a special category, a lot of insurance companies, even Medicare and, before Obamacare, the Affordable Care Marketplace, whatever you want to call it, it's all the same. They really didn't cover a lot of mental health, but part of the Affordable Care Act was mental health is now treated just as any type of physical health issues. And so recently that is even getting better. And there is one thing out there I need y'all to look out for, because I'm building this YouTube and TikTok and LinkedIn community as a community to where we're all looking out for each other. I have found, again, a couple of decades inside the Social Security beast, that a lot of people, when they file for disability benefits from Social Security, SSDI or SSI or whatever the case may be, and I've got videos on what the differences are between those. But people with physical disabilities, they follow up for the most part. People with mental disabilities, mental issues, they don't follow up. So I need everybody out there. So if you know somebody, a coworker, a family, a friend, whoever that is, can't work because of their mental issues and they file for disability, please check in on them and say, hey, how's it going? And because, the Social Security, bureaucratic beast is a beast. And remember, I've got 4 videos on how to file for disability and, improve your chances of winning. I just did those within the last month. But, go through those 4 videos with that person and say, hey, because invariably what happens is they get a letter from Social Security. It needs a little bit more information. And because of their limitations, they just, don't open it or they don't respond. And then the case just disappears. And then they just kind of spiral down, and it's not a good thing. So please, 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 let's look out for each other out there. Okay, please. All right, number 3, lower cost insulin, $35 30-day supply. You probably said, well, that's been around for a while. It was the federal government passed a policy that recommended $35 for 30 days, but now it's going to be mandatory. Up until now, insurance companies, Medicare Advantage and whatever, they were the Part D, the Part D, which are often packaged in with the Medicare Advantage plans, but the Part D, they were kind of voluntary. So a lot of companies were already doing the $35, but now it's going to be mandatory for insulin. And speaking of staying on drugs, because drugs is usually a big thing. I was just talking to somebody recently, and unfortunately they got stage 4 cancer, and they said, I don't know what I'm going to do. I'm going on Medicare, but my drug is $25,000 a month or some outrageous thing, but they get it in office. So they go to the doctor's office and get an infusion. And if that's the case, that's covered by Part B. So if you have a typical prescription that you go to the pharmacy to fill, even if it's a shot or whatever the case may be, and you do it at home, that's Part D, as in drug, dog. But if you get it in office as an infusion or a shot or whatever the case may be, then it's covered under Part B. But then again, you have the 20% deductible. That's why everybody gets either a Medicare Advantage plan or Medicare supplement plan to wrap around there. And again, if you don't have someone to help you find a Medicare Advantage or Medicare supplement plan, reach out to us, and we've got a network of partners throughout the country that help. And that's a free service. They help you out. Number 5, marriage and family therapists. Yes, those are actually covered by Medicare. Obviously, there's, just with everything else, there's limitations. You can't go, a whole bunch of times. And so, so marriage and family therapists are now covered. So if you have issues, again, this kind of ties in with the mental health And so, yes, definitely take advantage of that. Talk with your doctor, whoever, and say, hey, by the way, is this covered by Medicare? All right. And I need your help. So take a second here, and I need your help. Next week, I'm going to be doing a video on how y'all, as we say in Texas, all y'all can help with customer service, Social Security customer service, because that's the lament I get all the time is I've been waiting for my claim to be approved. I call and nobody picks up the phone. I go down to the local office, and the line is wrapped around the building 3 times. And what's going on? Well, I ran the 3rd busiest Social Security office in the country, and I think we were doing pretty good. But I've got a bunch of suggestions, and I need your help. Before next week, if you speak another language, if you're from another country, wherever, I would like for everybody out there that can call the Social Security system in whatever country. I speak Japanese, so I called the one in Japan, and I called the National Social Security system in Japan, and they picked up within 2 rings, and I got my question answered. I just asked, okay, how old do you have to be to file for retirement benefits? And they told me, and it's okay, thank you very much. So it was, but within 2 rings, and I got the answer. So I want to start a baseline. So please, everybody out there, call, Portugal, Panama, Canada, England, Italy, France, China, Vietnam. Call all these countries and see how long it takes for them to pick up the phone to answer your Social Security question. And we're going to use that as a baseline when we talk about Social Security customer service next week. So call up, jot down and say, okay, I was on hold for an hour and a half, or, I was on hold for 1 minute. And then next week you can throw that in chat and then tell me how long it took. And we'll use that as a baseline to hopefully improve customer service in this country, because it's completely unsatisfactory, as if I'm telling you something you don't know. All right, hearing exams. Hearing exams are covered. You say, wait a second. When I signed up for my Medicare plan, Medicare supplement or whatever, they said, the reason, I should sign up for this is because it has vision, hearing, and dental and all this kind of stuff. But now you're saying they have hearing exams? Yes. It's just a hearing exam, diagnostic. You have to get doctor's orders, and it's not for hearing aids. If you have to do another one for hearing aids and you have to get your hearing aids fitted or whatever the case may be, it doesn't cover that. So it's only kind of looking for diseases type thing. But hearing exams are covered once per year. And another thing kind of dovetails in that, vision coverage. Yes, vision coverage. Wait a second, vision coverage, but not eyeglasses. Well, it's more, again, for disease-related issues. So vision, a test for glaucoma. So a glaucoma test is covered by Medicare to look for, again, they're looking for a disease. But if you just need a regular vision test, as we think of the vision test to get glasses or contacts or whatever the case may be, then that's not covered. You'll need a separate vision plan. They actually do cover frames, very, very super basic. In the Marine Corps, we had, those black, those super basic ones. So that's probably what they cover Medicare. So if you had like a surgery or something like that, and you need kind of glasses based on a surgery for, major eye issues, then Medicare will cover cheap frames and lenses. So, all right. Foot care. Foot care is covered. Again, this is, they're, not foot massages or anything like that, but they're a yearly exam or treatment, especially for diabetes related issues, heel spurs, foot injuries, bunion deformities. So again, things, major kind of foot issues. And this is, I'll pause here and go on my soapbox. This is, it took us a long time to get prescription drugs added into Medicare, but we did it. We did it. Oh, yeah. Speak of that, everybody like and subscribe and follow and join and whatever you do on whatever platform you're on. but please, everybody, more people need to get this information. Yeah, so we did the Part D. We were able to do that. So awesome, America. Now we need like vision, dental, hearing added, because, you know, when you get older, I mean, how healthy are you going to be if you can't see, eat, or, you know, hear, right? So that's our next job, is to get all of those added into original Medicare, right? So let's go for it. All right. That's our long-term project. Okay. Here's a good one. It's very surprising. Chiropractic services. Okay. So this is, yeah, obviously there's going to be a lot of limitations on here. It's a manipulation of the spine to correct subluxation, which is when I had to look it up exactly what that, when the spinal joints fail to move properly, but the contact between the joints remains intact. So if you need to go to a chiropractor for to correct subluxation, the manipulation of the spine to correct subluxation, then Medicare is covered. So if you go to a chiropractor and they take Medicare, which a lot don't, but if you find one that does, yeah, then say, okay, is this particular thing, you know, and, you know, we also have to be careful out there of Medicare fraud, that, you know, a lot of doctors and chiropractors and, you know, whoever are, you know, they do this, but then they put it down as subluxation so they can get reimbursed and stuff like that. So it's our job to make sure, you know, those things are coded correctly. So yeah, there's that. This is a super surprising one. So if you like needles stuck in you, like a voodoo doll or whatever the case may be, acupuncture. Yeah, this is, I've actually had it done, and it actually worked out fairly well. But acupuncture, again, limited for lower back pain. So it's only for lower back pain as of now, and that's 12 visits in 90 days. So if you have lower back pain, again, you know, contact a acupuncture person in your area and see if they take Medicare, and ask them whether this would count and whether you would, you know, be able to do this on a Medicare. So yes, very surprising. I skipped 11. Oh, okay. Well, all right. I've got 13. So anyway, all right. So this is 11. Bariatric surgery, gastric bypass surgery, or laparoscopic banding. Again, this is always a little bit of limitations related to morbid obesity. So you just can't, you know, have a, you know, like me, like a little beer belly and go get a, you know, lap band on there. It has to be related to morbid obesity. As I think I already talked about, is eyeglasses. Again, standard frames, and after cataract surgery. So specifically cataract surgery, which I had done at 40s, and the doctor was surprised I had it done. So, and he's like, did you bring your child, doctor? Yeah. So anyway, yeah. So, all right. So let's see here. So those are the things that a lot of people don't realize Medicare covers. And now let's get into some questions and answers. Let me get all this stuff off the screen. And on those on TikTok, sorry that you don't see all the stuff on the screen. TikTok limits my ability to show stuff until I get 10,000 subscribers. So please subscribe or join or whatever it is on TikTok. I'm new to TikTok. All right. So everybody, please press like so this information goes out to more people. All right. So Vitri, hello. Hey, what's up? What's up? All right. Jim, hey, Jim, have you considered making a video about collecting earlier than full retirement and still working, staying under the income? Yep, I've got a few of those. Yeah, I've got close to 300 videos already up there in my library. Not bad I've been doing this for about a year. So 300 videos, about one a day almost. Yeah, I've got several videos on early retirement. I just did another one last week before last, on working, collecting Social Security benefits and working, how it affects and everything like that. And yeah, so absolutely. Next question, Afi. Hey, what's up, Afi? Is there a way around not paying 174 for Part B? Do not qualify for Medicaid to pay for it. Okay, all right. So good question. Thank you very much. No, unfortunately, but yeah. So it sounds like it's a good thing you added that second part, because that's what I was going to talk about, is the Medicare Savings Program, which is if you're eligible, if you get qualified for Medicaid, Medicaid will pay for your Part B. Yeah, that's the only way you can get Part B paid for, unless there are some Medicare Advantage plans out there that they're called, there's like the Patriot and, all kinds of different freedom plans and different things. But there's some out there, Medicare Advantage plans, that do pay, it depends on your area, that do pay for part of your Medicare Part B premium. So you sign up for the Medicare Advantage. Again, you have to have Part A and Part B, and you sign up for a Medicare Advantage plan, and you pick the one that pays for part of your Part B, and they're probably more likely a zero premium for the Medicare Advantage plan, plus it pays for part of your Part B. And you're like, hey, how can they give you all this awesome stuff? Well, this is your money. All that money you paid into FICA, which includes Medicare for all those decades, that's where the Medicare Advantage plans get their money. So when they give you all this free stuff, it's not free because you paid for it. You paid for it over many decades, and now you're getting it. So that's why I always say, check your Medicare Advantage plan every single year and get everything you're entitled to. A lot of people don't recognize that the plans, they're only good for 1 year. They change every year. Sometimes they change without you knowing it until you find out, until something happens and you get sick, and it's like, okay, wait a second, I thought I didn't have to pay any to go to the hospital, or this, that, or the other. And all of a sudden, it turns out that you have to pay a lot of money. So you have to be very, very careful and check those every year. And if you don't have someone to help you check those, again, call. I've got a bunch of partners. Oh, not that. That's not it. Is that it? Yeah. So call that number there, or email me and just tell me your name, what state you're in, because they're all state specific, and what you're looking for. And, we can see if we can find something better in your area. All right. And full disclosure, the partners support our channel here, support what I'm able to do here. All right. Medicaid is the same. No, Medicaid is, Medicare is the federal program that you pay into FICA all those years. There's, 1.45% you pay into Medicare when you work, part of the FICA, Federal Insurance Contributions Act. It's all insurance. And Medicaid is state programs administered by the states and with federal funding. And Medicaid is for low income, low resource individuals. So you have to apply for that through the state. And before I worked for the Social Security Administration, I worked for the Department of Social Services doing Medicaid and food stamps and all that other kind of stuff. But you have to apply for that. And if you're approved, you can have Medicare. You can have Medicare and Medicaid at the same time. And again, was it Afi? I think it was. She pointed out that, that if you have Medicaid, they just might pay for your Part B Medicare because it's cheaper for them. I specifically asked me about Medicare Part B. Yep. So that's, yes, that's Part B, exactly. Let's see here. The question is about the income cap. Can I begin collecting Social Security before I retire from my current job, as long as I stay within the income guidelines? 100%. Yes. You can retire if you're going to receive survivor benefits at 60 or retirement at 62. You're on your own record, or spouse benefits, or whatever the case may be, as long as you stay under the annual earnings limits, which is this year is what, $22,320. As long as you stay under that, you can collect your Social Security benefits and continue to work. Anything over that, Social Security holds back $1 for every $2 you go over. So yes. And yeah, watch my video I just did within the last 2 weeks on working while receiving Social Security benefits. I think that's the title. That's good to know because I speak Spanish. Okay, yeah, call some Spanish speaking countries and tell me and then make a little note and then join me next week. The thumbnail for our live next week, next Thursday, is I want you to improve Social Security customer service. So yeah, jot that down and join us next week and tell us how long how long it takes you to get in there, because everybody knows how long it takes to get into, to get your call answered at the 1-800 number here in the United States, 1-800-772-1213. Yeah, 30 minutes, an hour, hour and a half, 2 hours. Yes. Please provide the broker for Medicare. Yeah. So just call call the number there, the 888 number, and just leave a message. And this is this great studio and all this. This is a 2-man operation. This is me, and my son is now helping me out. So he goes through all the calls. And so just leave your name, your state, and what you're looking for. We help with Medicare Advantage, Medicare supplements, burial insurance, life insurance, because, it's all insurance. Survivor benefits from Social Security are great, but if that's all you got, then there's going to be issues with your survivor. And I can give you a few million stories on, I've been there. So we put you in contact with people that we know and trust and that will do the right thing by you. So your name, your state, your phone number, and what you're looking for, just leave it at that number, or you can just email me and we can have someone give you a contact and help you out. Diana, what's up, Diana? If you are receiving survivor benefits, will Medicare Part B be taken out of that when you turn 65? Yes, absolutely. Anytime you receive Social Security benefits, survivor benefits, retirement on your own, spouse benefits. Yeah, once you turn 65, then about 100 days before you turn 65, then Medicare will send you your package. And at that time, if you want to keep it, you just keep it. It'll have Part A and Part B. And then, there's 6 big financial gaps in there that you need to fill. Those are either through a Medicare Advantage plan or a Medicare supplement plan. You watch my videos, I always recommend a Medicare supplement plan, either a G or an N, if it's in your budget. If it's not, it's not. But watch my videos on that, and my big, long, super boring videos on all of that. So, and if you're on disability, you get Medicare after 24 months. But if you're 65, Diana, and you're working and you have health insurance from work, then you don't have to get A or B. You get A, it's free. But B costs you close to $175. But if you have health insurance from work, then you don't necessarily have to get Part B. If you're happy with your health insurance from work and it doesn't cost you an arm and a leg, and your employer has 20 or more employees, then you don't have to get it, and you are good. When you stop working from your or your spouse's work, current work, not COBRA or retirement or anything like that, it has to be current work. And then once you stop working, then you have 8 months from that time to sign up for Part B, and there's no penalties. I've got a video on that. It's titled How to Avoid the Medicare Penalty, Part B penalty. Yeah, something to that effect. It goes into more detail. Not all SSA offices are neglectful. Mine is totally awesome. Oh, I love to hear that. Yes. Yeah, there are, and that's an issue though. That's one of the issues I have with the way Social Security is kind of managed in that respect. Because my office was the 3rd busiest in the country, and we would have employees from other parts of the country, maybe your office, come to our office, and then it's like, oh my gosh, y'all have you know, and we had a couple thousand people, visitors every day, and phone calls and everything. And yeah, our office was completely just inundated. And they're like, oh my gosh, it was so nice and easy on our office. So I think, yeah, Social Security needs to do a better job of kind of workflow mobility, where the super busy offices that are doing terrible, that really need the help, offices like yours that, might be able to lend a hand, they really should do more. But we'll talk about that next week. And yeah, I had my superior when I worked at Social Security, he was really good on that. So hey, Ron, yeah, if Social Security just did everything Ron told them to do, then yeah, everything would be good. But yeah, so hi, Ron. All right, 60-year-old female, disabled, 2+ years, can't work, file for SSDI in February, 15 years, senior executive assistant. See, like MCAS, Marine Corps Air Station. Sorry, Marine Corps there. Fibromyalgia, SSA approved. Yeah, it's it's no idea. So many different variables. Based on all that, certainly seems like it. And she's was it Karen? Yeah, thank you for that, because that's a lot of things. That's one thing a lot of people miss when they file for disability. Was, again, I put in my 4 videos, secrets to getting your disability approved, is that people, for instance, Karen, if she would have did it wrong, then she would have just put one of these down and say, okay, here's my major issue, this is what really stops me from working, multiple chemical sensitive, and just put that down and then done. No, you have to put all of it down, because 1 or 2 might not get it. But putting all of those down as your limitations, why you can't work. So you have a whole bunch of limitations. So you did, it sounds like, everything correctly. Yes, February 15th. You just filed February 15th. And yeah, unfortunately, yeah, it takes, I used to tell people when I took disability claims, you'll get an answer in 3 to 6 months. But now people are telling everybody 6 to 9 months. So, Jim, does Medicare cover knee replacements? Yeah, if your doctor says, yeah, yes, absolutely. Original Medicare. Again, it's the thing about Medicare is, if it's medically necessary. Like I did an impromptu Q&A yesterday. I just popped up and started answering questions, and I answered this. And if someone had like a mole on their face and they just don't like it, then Medicare is not going to cover it. But if you have a mole in your face and the doctor, I think that might be, cancerous, possibly, so we need to remove that and send it out, then Medicare will cover it. So yeah, so if you're getting a knee replacement because you want to be the new $6 million man, then probably not. But if it's medically necessary, then yeah. And everybody, if you have a Medicare Advantage plan, then you don't have Medicare, you have a Medicare Advantage plan. They call them Medicare Advantage plans. They used to call them Medicare replacement plans, because now you have Medicare Advantage, and then you have Medicare, you have pre-authorizations. So your doctor has to get authorization from the insurance company to give you your knee replacement. If you have a Medicare supplement plan, the Medigap plans, then you do have original Medicare, and if the doctor says you need it, you're done, end of story. And Medicare pays their 80% or for the surgery or whatever, and then whatever insurance company you chose, they pay the other 20%. They have no say-so whatsoever, zero. If Medicare pays their 80%, the insurance company has to pay the 20%. You don't have to get authorization from anybody. It's between you and your doctor. That's why I recommend Medicare supplements rather than Medicare Advantage, but that's just me. Donna, at this point, with the economy still struggling, do you foresee a COLA raise this year? I certainly hope so. Yeah, I've make no secret that within the last 20 years, COLA should have increased by an extra 2% every year. But that's just me. Like last year, it was 8% or so. It should have been 10. They were talking about 10, but then the last minute they put it to 8. So yes, hopefully. Let's see. Hi, received a Social Security card in the mail for immigrant and didn't have to go to the Social Security office. Is this okay? You stated before we need to go to the Social Security office for immigrant. Yeah, if the person is um, a naturalized citizen or a citizen or a green card holder, a valid green card holder, when you file for a Social Security number using SS5, then if it's a new Social Security card, then the Social Security Administration has to, was it the form is G845? They have to send a form to the Immigration Department of Homeland Security to confirm that this is a valid, immigration document, that it's all that kind of good stuff. And so they go through all kinds of extra checks to make sure the Social Security number is going to the correct person. But if you received a Social Security card out of the blue, yeah, someone might be trying something sneaky. So I would call the 800 number. If this is someone you don't know and you just received it out of the blue, then if it's a valid Social Security card, then yeah. I did a video a long time ago, about 7 or 8 months ago, about a Social Security card that number has been used by 40,000 people. When Social Security, when was it? The 1940s, 1950s, some company that was making wallets decided to show people, that your Social Security card can fit in there. So they put the Social Security card in the wallet and then sold it to like Woolworths, all throughout the country. And the president of the company decided to use the Social Security number of his secretary. So they put the actual secretary's Social Security number on the card and then sold the wallet throughout the country. And then people after a while thought this was their Social Security number and they started using it. So 40,000 people were using the same Social Security number. So that's a little Social Security history you probably didn't want to hear, but all right. Kat, what's up, Kat? Can my brother-in-law apply for SSDI if he is still working but is having difficulty doing his job? If he's working over the substantial gainful activity, which is about $1,500, then no. Yeah, that's the one of the unfortunate parts of Social Security disability is that people call, they want to file for disability all the time, and they said, I'm currently working, but I'm working through the pain and disability because I need money. And yes, you understand that, but you're still working and you're still able to go in every day. So for Social Security purposes, you're not disabled. So if he reduces his work because of his disability and he goes under the substantial gainful activity, then absolutely immediately call and apply, or again, watch my 4 videos on that and it'll tell you how to apply online and all that kind of good stuff. So yes, absolutely. Question here on TikTok. I love fur babies. Okay. How often do I get rechecked to see if I'm still disabled? So you're talking about a continuing disability review. It really depends. Each case is different. When you're approved for disability, they give you, it's an MIE, Medicare, medical improvement expected date. And it basically said, okay, on this particular person, they'll never improve. So you never have to recheck, or, this one might, there might be improvement or something, maybe within 1 year or 3 years or 5 years or whatever the case may be. So it really depends on your particular case. So watch my video on CDRs. And the number one thing on that is don't stress. The whole CDR process is really stressing people out. And Social Security needs to do a better job about not stressing people out. But watch that. And yes, just don't worry about it until the paperwork comes in the mail. Sorry, I'm going through my TikTok. Everybody, please. Yeah, please, if you're on TikTok, please subscribe or join or whatever you have to do on TikTok, because I can't do it correctly because I don't have 10,000 followers. So what about healthcare while working and receiving Social Security retirement? Yeah, if it really depends how old you are. So if you're under 65, you're 62, 63, 64 and working, you're not qualified for Medicare until you turn 65. Then, the only other option in there is health insurance from your work or Obamacare, Affordable Care Act, marketplace insurance, whatever you want to call it. It's all exactly the same thing. So yeah, we've got people throughout the country, partners throughout the country that help people with the Affordable Care Act as well. So if you need that help, again, call our number, 888-817-0446. I've got it in the description and all that kind of good stuff, or just Google @MyGovExpert, and I pop up all over the place. And yeah, let us know what you need, and we'll find someone to help you out if you don't have someone. All right. Can you help connect me with a PASS specialist in Sacramento, California? I'm also 64 and wondering about my retirement plan as well. So a PASS specialist, yeah. So so that's for a program to become self-sufficient from disability, see if you can get back to work, or start your own business, or whatever the case may be. The Social Security contracts with the Ticket to Work. So it's Ticket to Work, and they can help you with all that. And there's also what are called AWICs, Area Work Incentives Coordinators, in each area. I think the one for Sacramento is in the Richmond Regional Office, Richmond, California. But yeah, you just type in SSA AWIC, AWIC, and it'll give you a list of all the Social Security employees that specialized in these work incentives. All right. Diana, do you ever think WEP will ever be repealed? WEP is the windfall elimination provision, and that is windfall because state, local, and city, county workers get a windfall. They get more. Diana's probably hating to hear this, but get more than everybody else. The other 98%, 97% of people that paid into Social Security, y'all get twice as much. I know you hate to hear that, but watch my video and it explains Take the WEP Challenge. I did a video last month on Take the WEP Challenge. Watch that. And nobody has challenged me yet on that. And you're saying, wait a second, I don't receive twice as much. You do, as a percentage. People, yeah, you get twice as much as everybody else as a percentage of your replacement. So watch that. And if Take the WEP Challenge. Like I said, nobody's challenged me yet. Joe, what's up, Joe? I'll get weekly pay from my company due to an on-the-job injury. Will that count against my SSDI? The local Social Security office said they only count that if I'm actually going to work and earning that pay. That is a fact, unless that is a public disability, like a public state workers' comp type money. If that is, that will count as your SSDI. But if it's just a private company that's just paying you because of your disability, and it's not a workers' comp type public disability, then yeah, no, they're correct. Yeah, so no, you're good. But the Social Security computer system is based on Fortran and COBOL from the 1970s, so it's a terrible system. And if you get money coming in, that goes to the IRS, and the IRS notifies Social Security, and then Social Security looks at it, and you might get an overpayment letter that says, "Hey, you said you're not able to work, but you're making all this money." All you have to do is take your proof down to the local Social Security office and say, "Okay, I got this money, but it wasn't, work. I wasn't going into work. I wasn't working. This was from an injury type thing," and they'll just, they'll take care of it. So don't freak out if you get an overpayment letter, and it's just an old computer system. It doesn't recognize that this money comes from, sure, it's coming from a company, but it's categorized as this, not this. So yeah. M54, hit this like and subscribe. All right. M54 is always looking out for me. Yes, please. Thank you very much. Yes, please. Plus, I'm terrible to all this Facebook and all this kind of stuff. So I got to get better at, anyway. But yes, please press like. When you press like, this goes out to more people. And I always tell, there's, if you look at my chats, you can see people that, oh, I didn't know that. Oh, now I'm getting this much money. I think we've found millions and millions and millions of dollars for people in the last 4 or 5 months. People contact me and, oh, now I'm able to get survivor benefits for the rest of my life. Now I'm able, and unfortunately, there's a whole bunch of other people that said, I wish I would have known that a month ago or a year ago or 6 years ago. So every time you press like and subscribe or comment or anything like that, YouTube or TikTok or Instagram or LinkedIn sends it out to more people. And because you just took a half second to press like and subscribe, you just might help some little old lady in Pasadena, right? So, Jim, look at your video list. I was wondering if any go into detail about how collecting early but still working can affect what you would get at full retirement age or 70 if collect at 62 but keep working. Yes, I talk about that in the video I just did a couple of weeks ago. Basically, the fact is, if you collect your benefits at 62, 65, 70, doesn't matter, and you continue to work, and that year is one of your high 35 years, then Social Security will automatically recalculate. So your retirement benefits are based on your high 35 years of earnings. So if you have a high year, then they plug that in, kick out the low year, and then recalculate. That's completely automatic. You don't have to worry about that at all. So, yep. So you could conceivably get 2 increases per year. You could get a COLA if Congress decides, COLA is basically kind of automatic-ish since the 1970s. They took it out of the political sphere. So yeah, COLAs are kind of non-political based on legislation that was passed in early 1970s to make sure it didn't become political, but nowadays everything's political. But anyway, divide and conquer. They're trying to divide and conquer us, making us go after each other and calling each other communist and fascist and un-American so they can do what they want. So, and we're falling for it. Yeah, I think some of us are waking up and saying, yeah, it's not this guy, it's those guys. So, but all right, don't get me started. All right, yeah. So yes, yeah. So I lost my train of thought. So yes, your retirement benefit can conceivably be increased twice a year by a COLA increase, or if you work, and that work is one of your high 35 years. And again, you don't have to do anything. You don't have to do anything about COLA. You don't have to do anything about the recalculation based on a high 35. It usually takes the recalculation a little bit longer to hit your monthly check, because Social Security doesn't know how much you made last year until you file your taxes and notify the IRS, and the IRS notifies Social Security, and then they do the recalculation. And if that doesn't happen until April or May, then they backdate it and then to January. So, April, May, you might get, 4 extra months of the addition. So, all right. So I think this is a kind of a follow-up on that. Let's see. Gene, my husband is full retirement age this year. He will file on his own. I am 57 and I earn more than him. If I pass away before filing, can he still get survivor benefits? Yes, absolutely. He is obviously his full retirement age, so his benefit amount won't be reduced because he's not taking it early, because he's his full retirement age. So if something should happen to you, this is not automatic. So, nothing's going to happen to you for the next 60 years. So you've got this on tape, so you can take that to the bank. Yeah, for anybody else, I'm not talking about Genie, but everybody else, if something happens to you and the spouse is not currently receiving spousal benefits, then you actually have to go down and file a claim for the survivor benefits and that lovely lump sum death payment of the $255. Again, so that's one of the reasons I added to my network of partners throughout the country, people that help you with life insurance and burial insurance, because yeah, survivor benefits alone, I've burial insurance, burial is about $10,000 on average, and $255 doesn't cover it. So I have, been across the desk from, hundreds of thousands of surviving spouses, and, much to the chagrin of them, they're going to, they were going to have a hard time just living on survivor benefits. So please do something, be prepared for not only you, but for your loved ones. So, yeah. All right. Chris, I am turning 65 in May and haven't received my Medicare packet yet. Oh, yeah, that's way too late. This is April. Yeah, you should have received it. So Chris, I assume you are receiving Social Security benefits, because you won't get it unless you're currently in the system receiving Social Security benefits. So you're probably not receiving Social Security benefits, or you are receiving Social Security benefits and you moved and you didn't notify Social Security, because when you notify Social Security of your move, they also notify Medicare automatically. So one of those two probably, or when you turn 65, every insurance broker in the country knows about it, and every company knows about it, and they just send you I call it you're the new homecoming king or queen when you turn 65. Everybody wants to take you to the Medicare dance, and especially sell you Medicare Advantage plans, because there's so much money in it for brokers. That's so that's a whole another diatribe I'll get on. You can watch all my videos about that. That's why I recommend Medicare supplements, because it's better for you, and not necessarily for the agent or the broker, but it's better for you. So you might have just thrown it away because you got so much stuff that looks like it was from official Medicare, but it wasn't. So yeah. So if you haven't, then you need to call Social Security and sign up for Medicare if you're not already receiving benefits. Chris, you have to apply online for Medicare. Yes, if you're not already receiving the benefits. Let's see what else here. I can see a need for customer service at Social Security Administration, but I think it is across the board in government in general. Yes, exactly. I work with a great group of young folks at Walmart, are great at customer service. Yeah, it's we did an outreach to a company that's pretty much world famous for customer service, and we went to their building, their office, their establishment, and gave them we talked about Social Security and Medicare and all that kind of stuff when I worked at Social Security. And I said, hey, but how about returning the favor? And so they sent their best customer service, nationally renowned customer service people to our little office with 100 people. And they started off the presentation by saying, if you don't do customer service well, your customers are not going to return. And we're like, no, we don't want our customers to return, because that means we messed it up the first time. So we want people to come to our office and we fix their problems, and we love you, but we never want to see you again because we did it correctly the first time and everything is cool. So we're like, oh yeah. And they're like, oh, that's right. You don't want return customers. I know we don't want return customers. So yes. Oh, Chris, Social signed me up in February. Yeah. So you should. Yeah. Something is definitely wrong. You need to check. You probably have it. It's just probably just lost in the mail. Yeah. So. Thank you for all you do. It's sad we are 34 billion trillion in debt. Yeah. So, let's see. All right. Let's see. Get some promotional things coming in here. I don't watch I don't really read the chats before I pop them up there. I should more often. But Sarah, I like your little geometric thing. For a married couple, are earnings limits related to Social Security calculated individually or jointly? It's individually. So, and that's, an issue when, kind of you do, self-employment, you both own the company and all that kind of stuff. But yeah, it's individually by Social Security number. So whatever you report, even if you're self-employed, whatever you report to the IRS on whichever Social Security number. So if if it's, self-employment and, your husband gets half and you get half. And so you put it under each Social Security number. And that's important. I did a video on what a lot of people are missing, spouses, particularly when they're self-employed, that it hurts them. It just might hurt them in the future. So Sarah, to clarify, both of us continue to work part-time. Okay, so just regular employment wages and stuff. So yeah, no, it's individual. Jim, thanks for all your details. Yeah, no problem. Yeah, that's why I I get a lot of comments on YouTube channels and TikTok and all that kind of stuff, which I love. Please, because that builds the algorithm, so this goes out to more people. But it's difficult to give comments on such important thing, responses to such important things, in just a short little comment. Because there's, again, if you watch any of my videos, there's exceptions to the exceptions. So I always like to add those in there so people are well informed. There's too many TikTokers and YouTubers out there that, just, I hate those 1-minute videos, but you got to do them. But most of my one minute videos also recently I've said, okay, here's this, but you really need to ask this, if you got questions, come visit us during our live Q&A. All right. Let's see here. Another question about the very popular one this time of the year is if your Social Security is taxable, does Social Security withhold taxes? No, not automatically. You can request Social Security to withhold taxes by submitting a W-4V. It's a small little slip of paper there. W-4V for voluntary. So you can tell Social Security, withhold, 7%, 22%, 15%, or whatever of your Social Security check if you want to. It's completely voluntary. And people always ask me, how much should I withhold? That's between you and your accountant and, whatever. But usually what I say is, pick one this year, and then, if you get money back next year, then maybe up it or lower it or whatever like that, and then adjust it the next year until you get it nice and tweaked the way you want it. Some people like to get that extra money back. Some people don't want to loan the government money for 12 months, and so yeah. Joe, thank you for doing this and answering my question. Yeah, no problem. Thank you. I genuinely appreciate your content. It's enlightening. Thank you. Appreciate it. Let's see here. We were on another page waiting for you for nearly an hour. Oh, sorry about that. Yeah, I wonder if that was I'm using this new system. I just added Instagram. I just added LinkedIn, and I think it doubled up somewhere somehow. Yeah. So. Yeah, I'm sorry about that. I'm getting this new system. I think So all right. So I'm gonna have to retweak this new system here. But anyway, sorry about that. Let's see what else here. So all right. Kathy, question. My mother's 78. Her only income is Social Security at $1,400 a month. She owns her home and has one vehicle that is paid for. She has $8,000 in the bank. Would she qualify for SSI? 8,000 in the bank, probably not. So she might have to do some type of spin down there on those benefits. Probably not. So, but, as everything else, apply, because that $8,000, there's exceptions, the exceptions. So I would definitely contact Social Security and have her file, because sometimes if the 8,000, there's set aside money for, burial expenses and stuff like that. So they might not count the entire 8,000. And so I would definitely check that out. All right, Kathleen, how can we get the fine print on the administration of individual advantage plans? Yeah, just Medicare.gov. They have the fine print there, and then when you actually sign up for them, there is kind of an outline of the program. But in Medicare.gov, you just find the particular plan. There's probably dozens, maybe 100 plans in your area. And what a lot of people don't understand is, you have to make sure you get it this year, because you signed up for a Medicare Advantage plan last year or the year before, and you're looking for that plan. That's gone. That plan left a year or 2 years ago. The plans expire every year on March 31st, and you get a brand new plan January 1. It may or may not be similar or close to your previous one. It really depends, but they can change it every year. So you can go to Medicare.gov, find your current exact plan. So make sure, if you pull out your Medicare Advantage card and it's one from, last year, then that's not your plan. You have to get your new one and then go to Medicare.gov today, or this year, and then look up the specific plan. It'll have all the details, and I've gone through them, and it's probably about 100 pages of details. Yeah. So yeah, sorry, someone was waiting on another video listed live. Yeah, sorry about that. Yeah, my system seemed to be pulling up the wrong one. Sorry about that. Yeah, I told you I suck at YouTube and all this kind of stuff. So Dr. Ed is spot on with his advice to take traditional Medicare and plan G or N. Could you talk about how people can switch away from Medicare Advantage plan? Yeah, there's all kinds of different exceptions. Like if you move, your Medicare Advantage plan, stops offering it in your particular area. You can sign up all year long for a Medicare supplement plan. The Part D is usually the issue, the prescription drug plan. Yeah, after you're 65, then the health insurance company, the Medicare supplement plan, they will ask you some questions because there's health screening involved. So so you'll have to answer. And usually what the broker, the agent, will just ask you like a dozen questions, 8, 9, 10 dozen questions, and if you answer no to them, or if it's a minor, whatever, then yeah, you're usually approved. So yeah, you can, and I've done a few videos on this, the mass exodus from Medicare Advantage to Medicare supplement. And I hear all the time, people look, the zero premium Medicare Advantage plans, those are awesome. And, until they're not. So, all right. So yeah, I've got a few videos on that. And again, if you need help, I've got my network of partners throughout the country that can to see if you're eligible to switch at what particular time. And again, so just call. Let me throw it up there. That phone number. Leave your name, what state you're calling from, and what you're looking for, and we'll have someone contact you and see what they can do to help you out. And again, as I mentioned, always, they support our channel. All right. Hopefully I don't lose you here with the audio. Let's see here. Okay, let's see here. Kathleen, no worries, your info is worth the wait. Yeah, sorry about that. Yeah, but you can go back. These are all recorded, so you can go back to my YouTube channel and watch the first part of it. I apologize for that. Yeah, I'm still getting used to this whole new system. I know the Social Security and Medicare information, but the YouTube stuff is all new to me. All right. Like I said, it's just me and my son, and Ed, as far as taxes on Social Security, it depends on how much you made from Social Security. Yeah, exactly. So there's so many different variables on taxes, how much you actually made from Social Security, and all your other income and stuff. So that's why I always kind of avoid giving out. I always say I've been trying to cancel my subscription from IRS for decades, and yeah. So let's see here. Does owning a home with no mortgage limit some benefits while on Social Security? No. Dr. Will. Oh, that's not my name, but I like that guy. Well, whatever happened to him? He used to do the PBS health type stuff, but Raymond Will? Yeah. So anyway, does owning a home with no mortgage limit some benefits while on Social Security? No, it doesn't affect your Social Security disability, doesn't affect your retirement, survivor benefits. It doesn't affect SSI, the welfare-based program, because one home and one car are exempt, so it doesn't matter whatsoever. So, do you have PayPal? Yeah, I think. But yeah, if you're looking to donate, I appreciate it. And just click the thanks. I've got in the description also the coffee thing. You can go through there and buy me a beer or coffee or whichever. Yeah, I appreciate it. Let's see here. Debbie Lejeune. Oh, Lejeune, as in Lejeune, yeah, the Marine Corps base on the East Coast. Wonder if it's related to you. Received SSI in 2000. Then hubby was working 2010. He had a stroke and caused him to be invalid. He drove 5 years, passed away. Wow. Let's see if is there a question in there? You're probably still typing the question, so okay, I'll move on and follow up to Kathy's question regarding her mother possibly qualifying for SSI with her Social Security amount of $1,400. Wouldn't she already be over the income threshold for SSI? Not necessarily so. Yeah, a lot of variables there that you can, yeah, because if she is receiving her Social Security amount, yeah. Okay, yeah, I think I read the question. I thought from other income, but if that's just from Social Security, yes, you are right, V. Ali. Yes, I was reading it from other income, and sometimes you can set aside some of the other income, but if she's just receiving it from Social Security as a regular retirement, disability, survivor, spouse, whatever the case may be, because the most you can get from SSI is $943. So yes. I was focusing. Yeah. So great. Thank you for keeping me on point here. I appreciate it. Thumbs up to you. Can I give you a thumbs up? Yeah. I just gave you a thumbs up. Thank you. Let's see here. Dun, dun, dun. Good evening. Can you explain how and why these Social Security overage problems happen? It seems unfair that due to an error by Social Security, the recipient has to pay up. Most people don't have thousands already. Yeah, so you're talking about overpayments, and I've done a few videos on overpayments and everything. Yeah, most of them comes from work. People that receive Social Security disability, for instance, and they work and they don't tell Social Security. So, or they tell Social Security, and because of, the antiquated system and, it takes so long to process it. It takes Social Security a month or 2 months or 3 months to, to correct the record. And then therefore you have an overpayment of 2 or 3 or 4 months. Same thing with early retirement. People work and some people say, well, I'm going to work and make over and it's only going to be $1,000 over. So I'll just go ahead and let it ride and I'll get an overpayment notice. And so a lot of overpayments come from that. A lot of overpayments come from people that receive the windfall elimination provision. They don't tell Social Security when they start receiving that pension. A lot comes from SSI, same type of thing. The SSI is a nightmare to do the calculations, the monthly calculations. If you're a month late, immediately comes an overpayment. So yeah, there's 1,000 different places that, and there's straight out fraud. Yeah, so Cynthia. No, sorry, Dr. No, no, just Cynthia. Yeah, I was just when I saw that name and I'm like, whatever happened to that guy? He had the good looking guy with the big beard on. And I think he didn't he do the Okinawa diet, which is like one of the best diets there are. Yeah, a lot of sunshine and vegetables and yeah. So all right, it has been an hour and 10 minutes, and I think we've gone through. I'm looking at my TikTok. See if I have any TikTok questions here. My daughter is 45, unable to work. She has 3 medical issues that cost her jobs. How long does she have to apply? Well, she can apply, pretty much anytime she wants, but I would recommend she do it immediately, if not sooner, because it takes Social Security forever to get her approved. So if she's currently not working or working below the substantial gainful activity, have her go onto my YouTube channel and watch the 4 videos I did on filing for disability, and it'll go through the entire process and give her some tips, tricks, and secrets from the inside. Yes, apply as soon as possible, please, and help. If you need to help her, please, yeah. And if you got any questions in the process, make sure you jump back into one of my lives, and we can see what we can do to help you out. If I have a full-time job with good insurance, do I have to get Medicare? Nope, you certainly do not. If your employer has 20 or more employees, then you're good. You don't have to do anything. If you're happy with it and all that kind of good stuff, and you've done the cost benefit analysis, it costs this much. Your employer plan costs this much and it covers this much, which is so much better than Medicare. And then if you did that and you're good, then nope, you don't have to do anything at all. When you stop working and you stop receiving health insurance from work, then you have 8 months to sign up for Medicare and there will be no penalty. Legally, you have 8 months. But you know what happens when you don't have health insurance for 8 months, right? Yeah. So about a month or 2 before you stop receiving health insurance from work, then sign up for Medicare. And that way, when one health insurance stops, the next day, the new one starts. Okay. All right. Concerning my SSI question, is there a chart that lists the thresholds? Yes. Yeah. I need to save that as one of the pages I pop up. Yeah, but it's what, $2,000. And in terms of resources, that's easy. About 3,000, I think it's for the couples this year. And then income there, again, there's so many different set asides, whether it's earned income or unearned income. And, there's impairment related work expenses that can, like if you're making $1,400, but, $600 of that is going to some type of impairment related expense, then the Social Security can discount that. And so there's so many exceptions. But as V. Ali points out, you can't discount that because that is unearned income from Social Security. If it was just other income, you could. But that's why I always say, Social Security there is the employees are there to help you see if they can get you, benefits, if you're entitled to benefits. So in your mother's case, I would apply. One thing I would definitely do is also apply for Medicaid. The $8,000 is probably going to be an issue, but $1,400, if all she gets is $1,400, then she will definitely be entitled to Medicaid. So there's that. Debbie, thank you, sir. Appreciate all the information and your time. We'll think of questions, jot them down. Okay, I appreciate it. Let's see here. SSA in my town never heard of the special rule. The first year you retire and stopped my check and sent me a bill for $6,000. Luckily, it got cleared up. Yeah, so that means they did. It just means, the person you talked to in the front window, which is a kind of I hate to say it, the lower level claims service specialist, and Social Security has hired so many different people. and they're not fully trained yet. And so that person just didn't know how to explain it. But they got it cleared up. So obviously someone in that office knew about it, because that is a fact. It's an exception. The first year you receive your retirement benefits, if you're 62, 63, if you start your benefits in July and from January until June you make $1 million, then that $1 million won't count. It's only starting with the month you start receiving your Social Security benefits. So have you done a video on how to best pay for extensive dental work? Not really. Yeah, dental work. The big thing now everybody's contacting me is about implants, and there's some Medicare Advantage plans that started covering implants. Yeah, that's one thing I think Medicare should add into, as I talked about in the first part of this video. We as American citizens demanded our politicians add prescription drugs, and they finally did after a few decades. We need to do something about dental, vision, and hearing and get that added into original Medicare. So that's our job, is to get our politicians to do our bidding, I guess, right? To do what we want them to do, because they're our representatives. But if you have a Medicare Advantage plan, or a dental plan, I've got a link for a company that I like that has dental and vision plans. It's in the description in the description box. But if you have dental insurance, the best way to do it is towards the end of the year. So like if you're covered, let's say $5,000, and the dental work is going to cost $10,000. Then what you do is you talk to the dentist, and they do this all the time. They say, okay, well, we'll do 5,000 of it in November, December, and then you come back in January and February when the money replenishes, and then we'll do the other part. So that's one trick. Dental, how long do approvals take on Advantage? Wow, yeah. Congress is working on that. There's been a lot of interesting things in the news, let's say, on all things Medicare Advantage, algorithms and kind of some scandals and mismanagement and all this kind of stuff. So I'm sure you've seen it all in the news, but it really depends on the particular situation, the particular procedure that your doctor is asking for, and all the rest of it. So again, that's why I recommend Medicare Supplement, because you don't need an approval from Medicare Supplement plan. If your doctor says you need it, then it's done. So, all right, we'll do a few more questions here, and then we'll call it a day. Sarah, my sister's husband is 9 years old. Oh, I think I already answered that, didn't I? Oh, okay. She will be 60. Okay, this is a sister question. So my sister's husband is 9 years older than her. She will be 62 next March and plans to take her benefit. Her spouse was the higher earner. If he dies before her, will she collect his Social Security benefit? Yeah. If the survivor benefit was higher, yes. So if she goes ahead and files for benefits on her own record while he's still alive, she can go ahead and file for spouse benefits at the same time. And then when, as we all do, he inevitably passes away, then everything will be automatic. Her benefits will switch from spouse benefits to surviving spouse benefits, and nothing has to be done. So, but if she's not on his record when he passes, then she'll have to file for surviving spouse benefits. Yes. Kathleen, yes, no dental and Medicare supplements. That is correct. But there's some supplements out there that are starting to add little bitty things, like, people love the gym membership. So I've noticed some Medicare supplement companies are giving, silver sneakers and different stuff. And there's some that are not, they're giving discounts. So they're saying, hey, sign up for a Medicare supplement plan G or N or whatever the case may be. And oh yeah, by the way, some of them I've seen, if you use our network doctors, then you get a little bit of discount. So yeah, there's that. Yeah, Robin. Yes, I apologize for that. My system pulled the wrong video in. I did the 11 surprising things. As soon as this live is finished, it'll pop up there, and you can go in there. I'm just doing the question and answer part right now. So yeah, thank you. All right, I think that'll do it for today. We got one more question. If you get Medicare at 65 and retire and have opt to pay health medicals, yeah, so I'm not, yeah, all right. All right, that is it for today. And I apologize for the people that had to wait in another place, but yes, so we'll, I'm getting used to all this YouTube thing. So amateurish on that respect, but everything else, I think I kind of been around. All right. Y'all take care and have an